Good evening, guys. Um,
Good evening.
Good
Hi,
evening.
Ahmed. Hi. For people who don't know me, I am Manikandan Katarvel. Hi, Mazin. Hi. I am Manikandan Katarvel. I am one of the consultant HPV liver transplant surgeon, and I'm the course director for the PrepMedico FRCS course. First of all, a very warm welcome for this quick interactive meeting between the candidates who have just passed out, who were in our course, and the people who have registered for the next exams, and potential candidates who are waiting to register for the next exam. So this is going to be a very quick interactive session. The main aim of this session is just to speak to the candidates and ask how they felt and what difference they felt on the day of the exams compared to what was taught before and what they thought before, and what would be the advice they would like to give to the next upcoming exam going candidates. So that's the whole purpose. Before that, I would like to congratulate everyone here, whoever has cleared successfully in the recent exams. To be very, very honest, this exam results were not as we expected. There were lots and lots of failures than we usually expect. Means I would say in the last 3 years, this is one of the worst results we had ever seen. That's what I would say. And many are still, they couldn't come out of the shock of going through the feedback. They couldn't understand the feedback of whatever they have given. And it's a lot of confusion. So we really don't know what went wrong where. But overall, the markings of the exams were extremely stringent, and the pass percentage was significantly lower in the September exams. But from our point of view, we are still happy from our course point of view that whoever had participated, because our course is something like a mentorship program which happens for 3 months, and whoever had participated, almost all the sessions they cleared. That's what I would say. But still, overall, if you see the number of candidates from our course who wrote, I would say the pass percentage was somewhere around 60%, which was far less than our usual rate of 90%, which we had in the last 4 to 5 courses. Yeah. So I'm not going to waste much time. So I'm going to call one by one here, whoever are here, who have recently passed, and I would request them to tell how they prepared, what they thought about the exam, and did they expect the same in the exams, and how they feel about the results, and what next. Yeah. Let me start with in my picture, Rashid. Hi, Rashid.
Hi, Mani.
Hi.
Nice to meet you on a different platform.
Exactly.
Well,
Yeah.
well, I don't have words. I'm still trying to sink in that I have got through the exam, to be honest. Yes, and after the exam, last starting from Thursday night when I finished my clinical, till Wednesday 5 p.m. till we got our result, I had sleepless nights, just tossing in the bed, calculating my marks. So 603, 604, 599, 598, and that's it. So much of adrenaline rush, just to know, in the end that everything was well. I had a safe pass. Thanks a lot to you and your entire team. I think that was the most important reason why I got through this exam very easily. I'll say easily because I have passed now. So it wasn't an easy one. Okay.
Yeah.
The most important thing I would like to say is that those 3 months, having interacted with you guys every weekend, and there was a persistent revision going on every week, and that kept things going rather than coming to the exam 2 weeks before, and with all the adrenaline rush, nothing is going to go in. Secondly, in the exam, it's a totally different scenario. You have got every sort of stress going on there, and it's very difficult to try to memorize and bring something which is in the subconscious mind unless and until you have practiced it. And this course, I think, is the best way to deal with that. And your support and everything, I think that was amazing. I wouldn't have done it if it was not you guys who have motivated me. Special thanks to you, to Meena. I think Meena is here as well.
Yep.
Akshay, and I can't remember every names, but
Yep.
everyone was so helpful in this one, especially to Meena. So Mani, just a formal feedback.
Mhm.
I felt from colorectal point of view, I was missing something. Meena was such an excellent for
Mhm.
the breast team. That group was active 24/7. And
Yep.
I felt like there should have been someone in the colorectal who have driven it that way. Do you feel the same?
Yeah, means it's everything big means we always feel that the breast specialty is very, very difficult compared to other specialty.
Yeah,
So always I think breast specialty team is a special team,
yeah.
and they are very, very intense in their activities. But yeah, means that's true actually.
Mm.
Yeah.
No, thanks again. Thanks a lot. Yeah, I'll come back if I think anything more. I'll let other people share
No,
their
sure.
example.
What I want you to add to me, what will be your advice
Okay,
or
yeah,
any take-home message for,
yeah.
because we have almost 15 plus candidates who are going to give the exam in February. They're all here.
Okay.
So I
So,
just want you to
so
give,
my
yeah.
advice from what I got from the exam is that you have got the knowledge. That's why you are taking part two. They're not testing the knowledge. That's an important aspect, but it's not just the knowledge that they are testing. They are testing how you come across, how confident you are in application of that knowledge in front of the patient. I think that's the most important thing. Eye contact with the examiner. Whichever stations I had direct eye contact with the examiner, they tried to confront me on answers, and I backed my answers with evidence. I felt like, did I do something wrong at that station? But when I see the marks, I think those stations went very well. I did exceptionally well in those stations in which they confronted me, and I stick to my point. No, that's fine. Like in a scenario, there was a ghost piece, a gynae patient came in and had a ghost piece, and he asked me, when will you operate on the patient? I said that I'll operate on the patient straight ahead as she's symptomatic. But he tried testing me on that. Oh, she had the ghost piece for last 3 months. Why are you trying to do it now? So in that instance, I thought of getting back a bit. Okay, fine, I'll do it in the morning. But then I realized no, so that will give a bad impression. So I stick to my guns. I said, look, I'm worried that this patient might get septic, and so that's the reason why I need to take it right now, even if it's 11 p.m. It doesn't matter. So I feel that my that answer and the supportive reason I gave behind the answer, they gave me very high marks on that station. So just to the people who are going to take the exam, have a discussion with the examiner. They are going to everyone. You always told me that they are there to help you. They will come across like they are not helping you, but actually if you stick to your guns, I think they will give you good marks. That is my take home message from that exam.
Yeah. So one question to you, Rashid. So in the 3 months time, we were telling you the exam is going to be like this and that, this and that. So did you feel anything surprised on the day of exam, or you felt like any?
No, none of the topic was that I never heard it before. Everything you went through the course was the exact same. I will share the details of whatever sessions scenarios I had. There's none of the scenarios where like I've never seen it before.
Okay. Okay. Fine. Good. So let me move on to the next person, and then I might come back.
Yeah,
Yeah.
yeah,
Because at the end, I will ask others to ask you any questions if they want to ask. Yeah.
yeah.
Adam Ahmed,
Hey, hi.
congratulations first of all.
Thank you very much. Like
Yeah.
like Rashid said, I learned differently, and I think with 4 kids, looking after 4 kids, I wasn't able to really come in every week and all that. It was really it was difficult, and but I went through the videos and all that, and I think I can't thank you guys, and in fact everyone else who volunteered and actually who was there in the vivas and who was answering questions and all that. So I think the way you approached the whole course was absolutely practical. Was that's what Rashid said. There was nothing different in when we went to the exam. I think the stress can take over you. That's understandable, but I think the way I approached the exam with your help, and I needed this. I needed all those videos because I wanted to know at what level they pitch the questions and all that, and then how they ask and all that. I'm personally someone who's never. I'm not worried about the examiners, but of course the whole occasion can be very, very stressful. I think examiners have respect for you. However, they don't treat you as a registrar. You should not be answering questions like a registrar. And I think that's something you touched on many times in the exam. They are colleagues. They want to know, are you safe with them? Can you work with them? Do you have what it takes to be a consultant? And when they challenge you, I mean, two ways of looking at it. Sometimes they prompt you, that sort of drops your marks a bit. But also they just want to know your thought process. And I think few questions in the exam was like, this is the scenario. Talk me through what's going in your mind. So they want to know what you're thinking. They may not agree with it sometimes. They mark you less, but the thought process is what they're looking at. Like Rashid said, of course, exactly. They know you've got the knowledge, but can you reproduce that knowledge in a clinical setting, in a clinical way, in a hospital? Can you run a team? And I think one of the things that personally helps me is that I've been always educationist. I've always been an OSCE examiner. I've developed curricula as well. So just even going to medical schools and being an OSCE examiner, that really helped me, because I knew probably the setup. I knew probably how we normally ask questions and all that. I didn't know what question would be, of course, but that helped me a lot. And I'm talking about 25 years experience.
Mm-hmm.
And then that helped me a lot, because I was like, you know what? This is nothing different that you've done. The questions can be slightly hard, slightly challenging, but there's none of them that is you haven't seen in the words or you haven't heard. Finally, I think the way I look at the exam is a post-take. It's just like a busy post-take, and you've got all these scenarios in a couple of days, and you've been on call on the weekend. That's exactly how I look at it. You will forget things. That is that's part of the exam, I think. But try your best to approach it in such a way you are not prompted at all. If they prompt you and question you, or sort of change the scenario, that's absolutely fine. But you try your best not to be prompted. And I think familiarity with the exam, familiarity with the questions, and familiarity with the whole process is actually what Mani and the whole team has been helping us with. I think we were 3. I don't know. I didn't see much of my kids in 3 months. I can tell you that much. I didn't have much with my kids. I think I've been shouting a lot at them. I've been frustrated and all that. But one thing helped me, because of those 3 months, and every time I had time, I had to look into videos and all that and read a bit, of course. But the last 2 weeks of the exam, I didn't touch anything. I chilled out. I literally chilled out, because I said, that's it. I can't think anymore. I don't think I can add anything, and I let it out. I literally chilled out. I watched Netflix a few hours of the day. I mean, I don't know. Probably it's the stress that takes over. But like Rashid said, I think those 3 months is what helps you with the course. But the last 2 weeks, I think we need to calm down. And just think of it as, being in the clinic. Colorectal ones, I'm an OG candidate. I was asked loads and loads of colorectal. My highest marks in the Viva and clinical was the colorectal, not the OG. And I think that because being in the DGH is all about colorectal and all that, my clinic sessions, outpatient clinic sessions, running independent clinics, thinking on my own, deciding things on my own, with a minimal supervision whenever I needed, that helped me a lot as well. And I think I remember the colorectal guys asking me a couple of times, twice, they said, bear in mind you're an OG candidate. Can we ask you this question? That is how deep they went into all the way up. And I'm lucky I did well in that. So yeah, this is doable, absolutely doable. But there is more to just reading and then trying to go through books and all that. There's more to it.
Yeah. Thank you, Ahmed. Thank you so much. Thank you.
Yes.
Let me move on, and then I'll come back with my questions to you. Yeah. Mohammed Motivia, congratulations.
Hi, Mani. Thank you.
Hi.
Thank you. Right, where to start? Yeah, it's a tough exam, and I must say, my own judgment, when I went to the stations, I came out happy. I felt like I did well, but in all honesty, I expected more marks than in some stations I was just passed as in 3-4 marks extra, and I must say that I felt like I was doing very well. I answered all the questions, I went through everything. What I noticed is, yeah, it's your impression doesn't make much or doesn't matter during the exam. Just focus on what's coming. Just go and do your best, come out, end of story, let's start a new session. Okay. During the exam I felt like I am doing my everyday practice in a way, as in take consent from the patient, take history from the patients, all these things. So from now on, I think you should think about the exam, think about the scenario and the stations and all these things when you're taking regular history in the station. I'm colorectal, and I must say that taking history for a symptom, just think about it as a symptom, like bleeding per rectum. You ask about this and this and this and that. Whether you do this in the clinic, well done, keep doing that. You will do that in the station, you will do well. If not, you need to get used to it in normal life, because your brain will be like in autopilot mode during the exam. There will be a lot of stress, a lot of distractions. So don't think that what you will memorize at night you will remember in the morning. You will do what you used to do with some extras from the studying. And I'm talking about the performance, not the knowledge. And this is like two different parts of the exam. So performance-wise, as I said, what your daily practice will probably be what you will do in the exam. So work on improving it and reflect on every meet with a patient or every decision you make, because this is probably what you will do in the exam. Knowledge-wise, I think obviously another part of the performance is obviously the mock exams, and the mock exam we had in this course, and every weekend all these sessions. Make sure that you attend, make sure that you participate as much as you think I can do it. It's just a case of incontinence. I can take history from that. When you are on the spot, you will find yourself missing things and stuff like that. So this is my advice in terms of performance. One more thing I did, I'm not sure if I didn't have much time to do it properly, but I put wrote some notes, as in these are the 5 things I need to ask about if there is a bleeding per rectum patient. This is what I have to ask about in incontinence, for example, something like that. Any symptom, like divided by symptoms, and put what you would ask about in history taking. History taking is important in the long case, because you will have to keep talking and keep asking for 4 and 5 minutes. I struggled with that during the exam, even though I have prepared for it. So this is one thing to put in mind. Knowledge-wise, start with the course. Every week when there is a session about, say, upper GI, HBB, something like that, you prepare in the 5 days before. During the week, you prepare the study material, whatever you study from. The most common things are tracking and companion and all these things. You have to have something to get back to get some knowledge. Obviously, in your special interest, you will have to go through the guidelines. You have to go through extras, some papers, important publications, stuff like that, which probably by the end of the course, you will start 3 months before the exam. So probably before the exam, you will know what you will need to know in your subspecialty. And obviously, the team here are doing a great job in that, especially in the specialty and the mock exam and the specialty lectures and weeks, like the specialty weeks of yours. I must say I've got maybe 3 or 4. Well, I would say 2 or 3 scenarios out of the mock exam. I had them in the exam, so I must say, yeah, it was useful. Definitely useful, and as much as the knowledge is important, I said that in the feedback after the course ended, and I will repeat it. Having a course that is structured to push you to start early and divide your studying on separate weeks. Each week has a topic is very useful, because if you are left alone, and I haven't done any other courses, but and I'm not promoting for this course for any reason, but what I'm trying to say is my experience is having started early and having started with a clear plan that this week I'm doing general, this week I'm doing HBB, this week I'm doing this, it made the preparation easier. Okay, so this is about the knowledge. Lastly, the last week before the exam, the last 2 weeks before the exam are the most important. Make sure you book your annual leave from now. When I knew about part A, I straight away sent an email. I am off those 2 weeks in 6 months. It was like too far ahead, but this is my plan, and it was very important. Try not to, if you can from now do swaps. Try to avoid the 12-hour shifts because they destroy the day. So even before the 2 weeks, you still have to work hard for another 2 weeks or something. And as Ahmed said, I haven't seen my kids for like I destroyed their summer holiday. Okay? But this is a sacrifice that everyone will have to do. So this is also one thing. Dedication is the key. You don't want to. Well, unfortunately, some of my colleagues will live it twice, but I passed first go, thank God. The thing is, you don't want to live this twice. So you don't go in with a 50-50 chance. You do everything, even if you think that's an overkill it to pass it first go, because the stress and the amount of sacrifice that you do for one go is enough. I'll say again, you've got 4 chances. First go is maybe a little bit challenging. As I said, I had a very great impression about what I did during the exam. I felt like I cannot do any more. And in some stations, I must say, in some stations, I passed by over 20 marks. Okay, and I was lucky that this was clinical case and it was high marks. So I passed. I had an easy pass or a good pass because of 2 good stations, but the other ones I failed 1, and the rest were just pass. So this, I would say, this is a very. I'm very happy with that as long as I passed. But what I'm trying to say is, this exam is not easy. You could do a lot of good work and not get through the pass mark because of just simple touches, and obviously there is some luck in it as well. It depends on the examiners, depends on the scenarios that you got. I must say I'm colorectal. Most of the emergencies and electives came as in special interest came like proper colorectal, my special interest. So there is some good work that needs to be done. But as I said, follow the course. The last 2 weeks, take time off. Try to travel around 5 days before the exam. I mean, some people go, the average is going 2 or 3 days, but if you have a family like me, you want to go 5 days earlier.
Did you go 5 days before your exams there?
Yeah, I went on Monday.
My God.
Oh my Lord.
I'm not joking about that.
I went the night before.
I overkilled it the first time. I didn't want to repeat it.
Okay, Mohammed, I have a direct question to you. So I spoke to you before the marks came out, yeah? I spoke to you and I know how you told me what all you performed. Were you happy with the marks which you received from what you expected?
So in reflection, in some stations, I felt like either me or the examiner get out of the course of questions a little bit. So I had an examiner who in a clinical station, academic station in the basic science, he asked me about like simple question like anal fissure, and he was going out of it to go to the mechanism of anal fissure and the muscle spasms and the blood supply and all these things. As this is the basic question, this is the basic science of the pathology of anal fissure, and he spent like good 45 minutes in the 5-minute station drawing a circle saying this is the anal sphincter and this is
Mohammed,
I was thinking like, get to the question, please.
We had the same examiner. And he was teaching. He was killing time drawing the diagram. I
didn't know why. I started to feel like I'm either a good pass or I am a well done. I'm dead. I'm failed already. So he's having fun with me. I passed by like 2 or 3 marks in the station. And to be honest, I could have done better in the academics. So I did the discussion very well, but but there are some basic definitions and stuff like that. To be honest, on the second day, I couldn't sleep well between the 2 days, so my recall was not that good. But I still passed. But it's just I was asked some definitions and I didn't do well. I felt bad about it, but this was the second half, and I seem to have passed it, as in the 3 stations of the basic science I passed in general. But it was just I didn't know why he was like going very easy and chilled and stuff like that. So this is one of the things. It happened in another 2 stations, and some things from my side as well. So I kept talking, like you know when you have too much information in one question and you keep talking, I feel like just answer the question, let him get to the second question. I mean, don't be tempted to show off what you really know about. Yeah, I know this question. I'll keep talking until he's tired. I think just answer as much as he wants to get to this next question, because you want to go through all the questions before the time is over. And the vivas, yeah. As a first experience in the first station, I was shocked that the time is too short to go through everything you know about the topic or go through all the questions. So in the vivas, you're not going to mumble. If the patient asks, if he asks you what do you want to know, be to the point, like a registrar is talking to you as a consultant, telling you about the patient. You will ask the very specific questions. You don't need to go through, I will do this, I will ask about the drug history, also allergy, stuff like that. Don't do this. Just go to the point. It's 5 minutes. He probably is just starting, like kicking off the station. It's not this is not going to give you a lot of marks. Just get to the point, because the management and the surgery and the complications and all these things probably will carry more marks. Anyone, I am not well, I'm happy to be corrected in this, because this is my impression. I may be wrong, but
no, I felt the same as well. I felt they didn't want us to waste time. Get to the point.
Yeah,
I felt that way as well. Yeah.
So the problem is, when I was going to the Viva, I was obsessed that I want to say everything and everything up to the A&E, and I want to explain what is important in the A&E. This is not what they want. I think they want a little bit faster pace to start the station, and this cost me probably the station that I failed, because this was my first Viva, and I kept talking, and I also like mixed things stuff. Said LDH instead of lactate. And he was like, he gave me the face, and I was like, I didn't even notice that I said it. So I was like, the one that we have on ABG, it's I then said lactate, you mean? I was like, yeah, yes, I'm sorry, I meant that. So this probably this is a station I missed. And in all honesty, I went out of this knowing that this is not good. I probably failed. So the last thing I want to say, to wrap up, the marking, they are very strict with the marking. I had very good colleagues, very good study partners who didn't actually do well in the exam, but they prepared very well, who didn't pass. So the thing is, don't underestimate the exam. No matter how good you are, you probably all are qualified. You probably are already maybe independent in every shift, like most of people applying for this exam. But this doesn't necessarily mean that you perform the same as good or as expected in the exam. So just focus, make sure that you do your best in the exam as well.
Yeah. Thank you, Mohammed. Thank you. I'll come back again. Yeah. Shadya, if you don't mind, shall I finish with Nisha, because she has a surgery to do? She just texted me.
Yeah, sure. That's fine.
Yeah. Hi, Nisha. So we were just discussing about how you felt before your exams, and how was your exams? Was it a surprise for you? How was your performance, and how do you feel after the exams, and how do you feel about your results? And we spoke about the very bad results this time, and first of all, big congratulations to you, because it's not an easy exam this time, at least, to have cleared here and sitting here and telling us. Yeah, so big congratulations, and over to you.
Congratulations to everyone who got through, but I would say who haven't, it's not a big surprise. They were very stringent in marking. I was feeling terrible the 2 days, lack of sleep. In fact, the second day, between the period, I slept very less, and I was thinking, oh my goodness, will I remember things? But I think luck, God, everything was with me, I would say. My first station, which everyone thinks would be the worst, was the best. It was a clinical, colorectal clinical. I got 10 marks ahead, more than required. And it went on well. I even reached trials and all. But when I finished the station, I had a feel they were trying to confuse me. It was a sigmoid cancer, 22 centimeter from the verge, and they were trying to confuse me by saying rectosigmoid, and they almost to the end they were confusing me that I would say chemorad. And then I talked to myself. I said, no, 22 centimeter from the verge, this is a sigmoid, so only chemotherapy, sort of thing. And when I came out, I was like, oh my goodness, have I done this absolutely wrong? I'm failing this station. I was really feeling only after that station that I'm failing that station, whereas I got that very well. All other stations, I would say, is I just got through, just borderline got through, where I was expecting very good marks in some, and in fact 8 in some, well, but I just got through. So they were really great. My fear was always academic. They allowed me to talk. I went through talking as much as I could. And in the end, they asked me some questions, which luckily were the questions I hadn't revised in the end. But I was lucky there. It's a lot of luck, but I would say, honestly, to anyone who is doing the course, is take the course seriously. There are so many who did not attend each day lectures. I have not missed a single day. I made a point that prior to doing the course, I try to finish that part, that session prior to that. That is something, if you achieve that before each and every lecture, that helps. And when you're doing the course particular, make some notes out, because you won't be able to listen to all the videos. And yeah, time is really tight. I mean, time really sails so fast. 3 months, I can't believe how soon it went.
Yeah, Nisha had 6 books. I can vouch for it. She got 6 books. I saw them with my own eyes.
Is it 6 notes did you take? You mean
She had
notes?
6 notes, and she had a small book, one which has got pinpoint points, and she was reading through it.
Okay, Nisha,
I was just looking at it
I
for 5
think
minutes.
because we helped you in clearing your exams, probably you should give that to us. Give the notes, and we will publish it. We will give you the authorship. Yeah.
It was the notes I took was from the class. Each and every question, I'm trying to take the points which is needed, which is important. And each and every question, when you discuss in the course, there are stuff that comes. There are, I felt with colorectal, I mean, breast was really good. Colorectal, we were so many candidates colorectal. We could have had a bit more of involvement. But anyways, I would say we have to prepare, we have to study. There's no other way. And once the course is over, another thing I thought, and I gave it a last try, was a week of session with a colleague who passed last time. He really prepped me so well. He went through all of his questions. He had written it so well. He's very, very methodical in stuff. And he gave me a Viva session each day for an hour and a half. And also he really helped me. And I would say quite many stuffs came in there. And that was a real good thing. So I believe revising and getting somebody to Viva, not somebody who are just professors or lecturers. Some candidates who have passed out, catch them to give you a Viva session. That will really help, I would say. And make sure that you attend each and every lecture. Take it seriously. I would say 2 weeks off is not good enough. Even 4 weeks would be good, but 6 weeks of dedicated preparation is something you need, at least, I would say. And it's very stringent marking. I was like, I felt some candidates were better than me, but they couldn't get through. I was casual in front of them. I thought this is just a session, like every daily session. I was so, my heart was beating fast before each session's going in, but I just said, Nisha, another day in ED, and that's it. Sit, and answer. That's all. So that's how I kept myself calm. In one session, which was my last session, there were 2 colorectal. It was a colorectal rapid fire. And towards the end, I thought I'm doing very good in that. That's the session they failed me for 2 marks there. Rest all I got through. But honestly, it was borderline. And in colorectal clinical, I got 10 marks ahead of it, which would have compensated another couple of failures as well. But it's difficult. How much ever you prepare, how you feel you have forgotten everything. But have confidence. Kandan always has said that believe in yourself, and I was really saying that to myself every day, every session. Nisha, come on, you can do it. You can do it. Because the moment you go down, that's it. You get. I never had a moment of pause there. I just was going on and on and on. And honestly, to me, if I haven't answered any question, was 2 questions. One was troponin level for a heart failure. I was blank. D-dimer, I was blank. I just mentioned thousands, I would say, is something I will bury off. But rest all I had answered, and still I got just a borderline pass. What I don't know is, have I finished all the session, all the questions? That was something I could not judge after the exam, that have I finished all, which I had to. There was one session, the examiners were very harsh. They were like, they were trying to be difficult. I believe that session was meant to be that way for everyone. The patients, they were very nice, but they talk a lot. They talk rubbish here and there a lot. So don't waste much time. Just be on points. Yeah. All I have to say is we have to prepare. It's not easy to pass. We have to prepare, and that's it. And practice with friends, practice with as many people you can. And the session is there, which gives you a good practice. If you consider each session seriously, then you will sail through, because you have revised everything before the session, and then you have got a mock as well. But still you need more. You need more of practice with some others as well, just before the exam. And believe in yourself. We all can do it. Nothing hi-fi. It's a basic exam, but they are meant to be strict. That's all. Were they not? Where if I ask myself that, were they too harsh? I would say 50-60% they were harsh, but remaining is, if you can get through, is from your own clinical practice and stuffs. Whatever we do daily is what we need to talk there. And all sessions were like that. Only 2 sessions were a bit difficult, challenging for me. That was a colorectal one, in which they gave a synchronous lesion, cecum and rectal lesion, and then they asked me even questions like, what are the types of pelvic accentration, which I didn't knew, but I guessed, because bladder wasn't removed, posterior was removed, and I just guessed, saying that it's a posterior eccentric, and I was correct on that, luckily. And I believe that all gave me a better impression. So it's all, quite a lot is luck, what you remember, what you have, what your thought process is right there. You're listening each and every word what they're talking, and answering up to the point. I'm late, I'm slow in answering, and all I feel that time would be a big factor for me, but I thought I did it all right, pretty fast, like talking up to point, not wasting time. Not all sessions you need to say everything like crisp, ATLS, not all sessions you need to. So be depending on the question, keep yourself answering depending on the situation. Because if patient is in a medical ward and they have done things and they are asking for advice, you're not going there to do ATLS or a crisp protocol straight. So you can save a lot of time that way, and just go through, sailing through all the questions. All I would say, good luck to everyone.
Thank you.
Just prepare.
Thank you, Nisha. And one question to you. So we know that when you are going through the course, means the one constant question you commonly ask me is, means you had, and many asked us, whether whatever we discuss in the course are all essential. Yeah. Everyone felt that we were discussing too much in depth. Yeah. And and I was always telling that the exam won't be this difficult as what we discuss in the course. It is 50% easier than what we discuss. Do you really think, or do you think that this much depth of discussion during the course is essential for attending this exam, or did you felt that, did you prepare too much to attend this exam?
No, I think it is needed. It's needed because you never know which aspect of the question they are gonna emphasize. It could be a simple thing based on the ED attendance, and it could be something simple, but um, they can focus on one part. Like if it's a hernia, there were many other things with my friends also. I practiced who I was about the types of the EHS hernia classification, and about the loss of domain, and there were some formulas for that and few other things. So I would say the main questions which are very common, like femoral hernia and the abdominal anterior abdominal wall hernia, a few others like which does come, one or the other should be there. Prepare that through and through. Anything they ask, you should be able to say. And I don't think you in the session, whatever you have taught is too much. I believe that all is needed. That all is really needed.
Okay. Thank you, Nisha. Mohammed, you want to add anything, Mohammed?
Yes, definitely. Nothing in this course is out of context. You'll find a lot of things that you thought it's sci-fi, and you will get it in the exam. One of them is the missed swab scenario. I never knew about this. Like I heard of it, but maybe saw one case. But identifying this in the CT and the how to respond in terms of medical legality and the other, like not the holistic look at the scenario rather than the pure medical thing were very relevant and were important in the exam. And when I saw it in the course, I was like, I'm not sure about that. The other thing is that I forgot to say, and it's a tip, you don't have to follow it, but if possible, try to have a separate study group, and ideally from different subspecialties. You support each other very well, and when you have like a quick question, breast, let me ask him, and they will give you like the answer. And usually people in subspecialty are aware of what is relevant to generalists and what they don't have to know about. So the course provides this in a way, because there is a discussion group and you can ask the question in the group, and the responder from the faculty will give you the great answer. But having when you are a candidate and you are working together and you have a plan together and you're doing some studies together and all these things, this helps a lot. At some point you will feel very down. You'll feel like I'm going to postpone this exam. This is not working for me. I haven't studied in the past week and all these things. But when you find some people in the very same situation and you support each other basically medically, as in from the scientific point of view, and also morally, you support each other. So I highly recommend that you have a group of 2 or 3 study groups. That's it.
Thanks, Mohammed. Thanks. Rashid, let me move to Sharanya and then come back to you. Yeah. Sharanya, you want to tell us something?
Yes.
First of all,
Hello.
big congratulations.
Thank you so much. Thank you very much. First of all, I would like to thank you. I think I would proclaim you as a statistician. Okay. I think I scored an 8 in academic. I did really well that station, and whatever he asked me, I answered. So I presume and he finished, and we had 20 seconds left. He said, I think I'm done with all the questions, so
Okay.
you can breathe. And he said that to me. So I had time. So, and then particularly to Mr. Meena Gregoris, I think he's around here. Thank you very much. And apart from that, Manoj, Ambrish, I think all of them really helped me a lot. Starting from the course itself. So this is my first attempt. So this is my first time everything. So I didn't know what to expect. And I went into an exam because all of us know surgery. We all know that. That's why we are here. But it's how to formulate the answers, how to make sure you have the impact on that particular time is one thing. So that is the main thing, which I think the course really helped me out in that. And we did discuss extensively. So I would say that. An example I say is I did score very well in general surgery rather than breast, though I did pass, but it was quite high in general surgery. I don't know whether there are breast trainees who are coming for the exam, but I would say breast was very difficult. It was extremely difficult exam. I have no idea. They were not really quite, they were all had a poker face. They were all having a stern face. I did not give out anything. All the scenarios had layers of complexity to it. They were not straightforward at all. Everything. And at one point, I was there was showing my mammogram with a multifocal DCIS, and I kept saying them. They're asking. At one point, I said I've discussed an MDT. The examiner looked straight in my eye and said, "You are the MDT. Come on." And I was like, "Okay, fine." So it was very going on like that. And one of the examiners was Scottish. I had to lean forward to make understand what she's speaking. Her accent was so difficult to understand. So that is also there's a couple of exams were from Scotland, and Scottish. I'm actually from North, and I had a difficulty in picking up a Scottish accent. So that was difficult, and they were just keep on mean, and they never moved if you didn't answer that question. Technically, when you say you don't know, they tend to move to the next one, which happened in Gen Surg some point. But they just kept and looked at me and said, "Yeah, go on, try." So every exam, there's one question which is a very straightforward question, but they went on said to me, "We are supposed to give them chemo." He came and said to me that, "Oh, the patient is getting married in 2 weeks. She doesn't want chemo because she wants her hair. Now, what do you want to do?" So every question had a complexity like that. One of the scenarios said the patient was delayedly referred. She was not had a 2 week wait referral to us, so she had a nodal metastasis by then. So one of the examiners said, "I am the patient," and she got very angry and started arguing with me and started shouting. Literally, she was loud and was screaming, saying that, "Well, how do you deal with it?" It was the end of the station. I was like, already I was a bit stressed, and you just keep and she was screaming literally. How can you think? I think my life is gone, and she went on going on and on like that. So I really don't think I think whoever is going for breast, they really need to be very, it's going to be very complex, because I did speak to a couple of my friends who did breast last couple of years, and they never said it was becoming very complex. I felt they're quite complex this time. Even general surgery, my answer of being a breast surgeon didn't work. So there was one scenario where he asked me how would I do a cystogastrostomy. I said I'm a breast surgeon, so I don't technically do it. But then he looked at me again. He was an old professor. He said, "No, you are a general surgeon. Now, again, tell me how will you do cystogastrostomy?" So, I mean, I've done 4 in my entire life. So I said, only cystogastrostomy I know is open." I said that. And then he went back and said to me, "Will you do laparoscopically?" I would be like, in my hands open itself is not going to work. I'm not sure why do you want to do a laparoscopy, because everybody went on vacation. So, and again, I did not have much of vascular experience, and I had a vascular gunshot scenario. And again, he just kept, and for some reason, orthopedician was operating. I have no idea why that happened. Then they call you, not the vascular. So I said, "I'll call the vascular. The patient's limb is dying. Or do you want to wait for a vascular?" So I wouldn't, some of them are very nice. Actually, they really helped, and they said, "Okay, what else? What would you like to do?" Some of them, no. I would say 70-80%, because every station breast was like that. So I would completely say entire specialty was like that. And the general surgery was, half of them are really good. They were okay. And they asked me to do anterior triangle, which was funnily fine, but it's still. So there were some scenarios very kind of complex. And I didn't expect as a breast surgeon, I would have to deal with that. And again, there was a scenario, my long case was actually an ascending colon tumor. And I said I would refer to colorectal and everything. He just said, "As for today, let's assume you are the colorectal surgeon." I mean, I would not want to assume it. But anyway, it was all, I don't think being a breast or being some other specialty doesn't preclude you from answering other questions. They still want you to say, because at the end of the day, it's an FRCS general surgery. So they expect it from you. So that is what I would want to say. And a couple of things is, it's a very loud, it's a big hall, a lot of people saying a lot of things. You might have to be very clear and crisp, otherwise examiners cannot hear you. I think they could have missed some bits. So, and the patients, I had a very old lady in the breast scenario. She just kept talking and talking nonsense. I don't even need those information, but she just kept saying them. And I had to cut her off in the middle of the time. So I don't think you should be scared to do it. Otherwise, you'll lose your entire 30 minutes. She just started talking about a great aunt who had breast cancer. As long as I know her great aunt had breast cancer, doesn't matter to me. So she just went diagnosing everything about that. So they just kept talking and talking. So again, I think I had to cut on a couple of areas. And and other one of the general surgery scenarios where there are a couple of, it was just about critical care scenario. It was just about pain management. And they asked me doses and how would I do a thoracic epidural? What are the layers in that? I really I couldn't remember at that point. I said I would skip. But that was a quite difficult scenario for me. They wanted me to know what is the difference between spinal, thoracic, epidural, what are the layers of spine and stuff. It went down to so much of anatomy in that area, which I don't really think why there's a critical care scenario on that one. But overall, it was a very stressful time. And there were a lot of things which goes on in your mind. So I think I got a lot of people say, just relax, just think. And one thing I did understand from the exam was you give them an answer and you justify why you're doing this. They accepted it. Okay, fine. It's fair enough. I'll take it. They did say that. So as long as you have something to justify your answers, you should be okay. And it was more or less like a discussion rather than examiner question and viva session. It was like rather than healthy discussion between two equals is what they expect. So giving them a scared look, maybe thinks that, oh, come on, let's go beat them more kind of attitude. So I think maybe a good smile face and just take it as how we do a general everyday scenario, because that's what I think I taught the general surgery scenarios. And it was okay, but I think it's a bit stressful, and it was a lot of difficulties in explaining things, because you tend to say something and the question was like, I started explaining, there's a question of huge inooscrotal hernia, whether I do it in local. It was a huge hernia. I said I wouldn't. And I started telling her why. She stopped me and said, will you do it or not? It's a yes or no. And I said, no. Good, let's move on. So just listen what probably they're asking. They don't ask sudden times. They don't ask the whole thing. They just want a statement which you should give. You should progress. And some scenarios, in particular in breast, I didn't have full time, particularly the short cases. I didn't have enough time because when you asked the question, this bell rang. So I think we couldn't much progress in certain breast scenarios. So I did pass, but it was a bit more of complexity in them. And all the 3 breast scenarios and cases, clinical cases, and the 5 in short cases, I would say probably 3 of them are straightforward out of all of them. The rest of them are all complex. I did not have a straightforward scenario. Even I had a pregnancy breast cancer, and it was quite early in the pregnancy. Again, it was not quite late where you could wait for a few weeks until everything is done. So I would say expect it to be difficult. If you expect it to be easy, then it's going to be a difficult exam. It is a difficult exam, and this is what we should expect it out of it. Preparation, I think 3 months of preparation, because beyond it, I think you really get overloaded. I don't think preparing for 4 months, 6 months is not going to matter. It's just the 3 months. I only started the preparation. I started the course. I didn't prepare before. So 3 months of preparation is more than enough. And I think we extensively discussed almost everything in the course. I didn't think they had something different. Of course, the questions were different, but the baseline scenarios were same. And other than that, rest. Last 1 or 2 weeks, or maybe last 10 days, all I listened to was the lectures. I never studied anything new. I just kept listening to the same thing and again and again. Probably my parents came to visit me. Entire family can now, and they can, if Meena talks somewhere, they can know, oh, this is Meena Gregor's voice. They can pick his voice anytime, because we had like 6 hours of breast specialty, and I just kept listening to them again and again. So I mean, just listen to them. I did go the previous day only, but sleep. I had good food. I'm still doing the swabs I've done for the exam. I've not still finished my swabs. I swabbed for like 2 months before the exam. I never did on calls and on nights, and I'm doing all of them now. And I only did standard days, and I took 2 weeks off before the exam just to be well fed, well hydrated. That's more important. You shouldn't be sick. If you get sick, then you really waste your entire time. So eat well, drink well, rest well, just read them, just take some points so that you know them. Then I think you should be okay. It is not really a test of your knowledge, it's a test of your common sense, so that you don't say something stupid there, and test of how you work under pressure. I think that's the main ideology of the exam. It's not the knowledge they want. They do understand you already have that, because it's a ST7 level exam. And they do expect a lot in other specialty. I thought we only needed ST5 for upper GI or HPB, but they do want more. It is not ST5. They expected a lot more from a breast surgeon in terms of vascular and OG. And I had a bile leak scenario. They just kept on and on. They said, how would you repair it? I said, I will go with HPB. No, okay, fine. What do you think HPB will do? I wouldn't know, but I just what I said and what I read it. So they did expect a lot from him. So the blanket statement of giving the other specialty name, I didn't work this time for me. Yeah. At least for me, it didn't work.
Yeah. No, it recent means in this exam, there were quite a lot of changes which we saw as well from the candidate's experience, not only starting from the markings itself, but the depth of questions which was asked to other specialty members were quite in deep actually, rather than whatever has been put up in the syllabus of what they need to know. Good to know that anyway. Yeah. Thank you, Sharanya. Anything, Rashid and Mohammed, you were raising your hands. You want to add anything, Rashid?
No, just what Sharanya said. So it will be a good, easy points to get if you go slightly in details about your general station. So I know people do read about specialty because they think that they're going to be asked in depth about ST8 knowledge. But if you do that, so like my general was on a OG scenario, paralysis esophagus, and they went into quite details about it. So like all the Prague classification and how will you screen this patient, surveil this patient. Then what if it it gets low grade dysplasia? What second time low grade dysplasia? What if it's high grade dysplasia? How will you do a Nissen's fundoplication? What are the complications? The patient is admitted after a Nissen's fundoplication with not able to swallow water. What will you do now? What investigations? So it's quite in detail. So it's not just like fine, I'm a colorectal surgeon, I don't need to learn that. And the good point is, if you tell them, you will be marked very highly on those scenarios, and that will even if you go slightly lower down in your own specialty, that will give you a big boost. I think that's the reason why I passed very safely. You know that, Mani.
Spot on. Absolutely true, Rashid. Absolutely.
I think that's true.
Yeah, spot on.
Because they are expecting ST6 level from you, and you are giving them the answer of ST8 level, and so that's why getting that kind of number in your subspecialty is slightly difficult, but in other specialties it's easy.
Easier, yeah, absolutely.
That's right.
Yeah, because I did get like on those stations particularly, I did get more like 10-15 marks in those special areas because I did answer those extra questions, which is certainly not necessary. You won't fail because you didn't know them, but you obviously got this extra marks which helped you to give a comfortable pass.
And you can see the smile on the examiner's face when you answer the difficult
so true,
question.
Rashid. You're absolutely
He was so
right.
happy.
Absolutely.
He was so happy. He was not expecting those answers from you.
Yes. Super impressed. Exactly.
Exactly.
Yeah. Good to know. I was just looking into.
But I think many you said that before the course, the beginning of the course, you said they're almost going through general. It's almost like they're getting rid of specialties in a way. It's like a proper general surgery examination. Yeah. And that's what you said in June, I think.
Yeah. No, absolutely. Means as Saranya told, it is a FRCS general surgery exam with some specialty. So the specialty covers maximum maybe 35-40%, maybe 45%, but the rest all is general surgery. And again, general surgery includes all of the specialty. It's not just general surgery. We don't know. We really don't know what is the definition for general surgery. So everything else is general surgery actually. Yeah. So I'm just looking into the list. If there is anyone else who has passed us here, I don't think anyone is here. Guys, whoever has joined here, majority of you I don't know personally, but if you have any specific questions to me or pass out candidates here, you can ask actually about the exams or how to prepare and stuff. You can raise your hands and I can probably name. Ahmed, you want to ask anything? Yes.
Yes, please. Yeah. First of all, I'm happy to join this course, and I'm very pleased for all the successful candidates. And I would say congratulations to you all.
Thank you.
Thank you.
I would just want to seek your advice. So as Mahmoud mentioned, the good way he did it, and I believe the rest of candidates have did that before. Like for example, this week you got general surgery Viva, so you have to revise and just to read about it, so you make the better use of the when you attend the lecture. So from your experience, that's all successful candidates, what are the best sources to crack the start with? So I know that the most popular is like the Viva book, the white book, the Viva book, but there are many sources. I would just want to take your advice. What do you think? What is the best sources or source which I have to focus on, not to get confused and lost between the sources? That's my question. Thank you.
Anyone wants to answer on this, guys?
Yes, I can.
Okay.
Yes, Rashid.
So, Ahmed, just can you tell me which specialty you are?
I'm colorectal.
Okay, so fine. So, yeah, I'm the best person to tell you that. Me and Mahmoud.
Thank you.
So what I did was the white book. So I read it multiple times. So it is such a nice book, very concise, but you will forget it. Just revising it 2 or 3 times, but won't help. You have to go through it multiple number of times till it sticks in first.
Okay.
So secondly, this course will help you a lot. It will go through each and every aspect. What I also did was a FRCS Viva. There is a website, FRCS Viva.
Yes.
It has got at least 32 scenarios in colorectal.
Yeah.
And
okay.
that will make your understanding of colorectal subspecialty very good.
Yeah.
Okay.
Okay.
And also on your subspecialty wise, you need to have guidelines from ACP GBI, ESMO guidelines on rectal cancer, anal cancer, plus emergency surgery guidelines, not the guidelines, but position statement emergency surgery from ACP GBI. I think if you do these things, you don't need any other stuff. All rest of the things will be covered in this course.
Okay.
And they have got a very, very nice library, which you will get access when you register for this course.
Yeah. Okay. Thanks for your advice.
Yeah.
Thank you,
Ahmed,
Rashid.
it's a very
Mahmoud,
good question, actually.
Yeah, Mahmoud, if you can ask, if you
want to add anything, Mahmoud?
else.
Yeah, same. Cracking is your start and possibly end point. This is very dense. Whenever you get lost or get a question that you think it wasn't in cracking, it is probably there, but it's like 2 words at the end of the last line of the last page, something like that. So it's very, very dense. The fact to the point that you will definitely miss some information or details on your way studying it for the first time. So you literally need to go multiple times. ESMO guidelines are beautiful. This sources when you go in ESMO is like the European Society of something. What's it called? I forgot it.
Even if you go through,
you don't need to remember anymore.
No,
ACP GBI website, they will take you there. That's European Society of Medical Oncology. ESMO.
Okay.
Yeah.
Okay.
Yeah, Ahmed, it's a very nice question, actually, because the main problem when we start preparing for the exam is everyone says different resources. There are plenty of resources available. Like 3 years back, there are only 1 or 2 books, but now I think there are like 5 or 6 websites are there, 5 or 6 courses are there, and 5 or 6 books are there. But if you see into everything, almost everyone tells the same, actually. It's the area covered is almost the same. It's the style alone is the difference. Okay. So what, as everyone says, is I think even me, when I prepared 3 years back, I had the same. It's the same book. The problem with this 2 books is it has not been updated for many, many years now. Yeah. So majority of the advanced, the basic stuffs are okay, but the recent advances, the management part is all outdated, including the book, the other one, what is it called? The companion series books. Yeah, the companion series books is all very, very outdated. Yeah. You can go through it just to know what are all the topics which you need to be aware and what are the basics. And beyond that, you need to go through the papers, discuss with us, discuss with these things. So you should have a base resource, start from there. And then probably when you go into our course, we will try to cover, and then there will still be areas to cover, and still there will be questions which might come in the exam, which you have never heard before, but we cannot help on that. But at least you will be, so you should have one resource to know what all area in a particular specialty you need to cover. And that resource, I think what they say, this book is very good.
Yeah,
thank you.
I think I'll summarize it in a simple my way. Everybody's different. You learn differently, and you need to appreciate how you learn and who you are. I'm someone who didn't read cracking, and I didn't read companions. I was fed up with them, speak too much, and it's just how I couldn't handle the amount of information in there. But of course, I picked up, and I was very particular which one I'll read and what particular chapter I'll read. But I like websites. I'm a massive fan of websites. So FRCS Viva and higher FRCS Viva. So the chappie who had higher FRCS for part 1 also now has the Viva question. I think Mr. Siddiqui was really, really, really good. And so these two really, really was helpful to me. And I think having an open mind, I think all the guidelines, particularly your specialty, all the data, all the information, all the sort of articles and all that were being shared. These are the ones that really, really help me. That is me. So I think very, very important to understand who you are, how you read, how do you like to read. And I think what I did was I referred back to my MBBS days, how I used to read and how it got me through that. So that helped me in terms of reading. But in terms of knowledge, of course, you need all the resources, and you need the help with everyone else around.
Exactly.
That's me.
Yeah, exactly. Means I am a big fan of UpToDate, actually. Means I, even for my super specialty exams in GI surgery, I never touched any book. Everything I studied from UpToDate. Even for FRCS, the basic I will study from this, whatever is the recent management, because UpToDate gives everything about what is the recent thing in terms of chemotherapy, radiotherapy. It may not mention straight away as ESMO, this and that, but at least you will know the crux of what is it very, very clearly. So I followed UpToDate a lot, actually. Yeah. Sharni, you want to add anything?
Yeah, so what I just did it differently. I studied. I did not use much of these books because one, they were extremely outdated for breast, and second, breast is not even updated for last 5 years, I think. And now it's all changed. And rest of them, I thought some of them are quite old. So I went to the JCI website. They have a syllabus, and you can download them and print it out. There were like 13 pages, and they're specialty specific. So I would go through them, and whenever we study, I just used to tick them with a marker, and there were certain topics which were not given in any of those. For them, I Googled them. I used UpToDate. I used StatPearls. StatPearls is also a good resource. And you can just, there were like a lot of melanoma, there were kind of melanomas, skin cancers, all those. And actually they have anesthesia in that. And that was one of my scenarios which did come this time, anesthesia and pain management. I did study that. So you can print it out. It's like 15 or 16 pages, and there is only section 2. You need to, a lot of them are section 1, which we don't have to do it. I just used to mark them and just make sure I read through all of them, which I did. So that helped me a lot with excess things, because the book is too much of information and some of them are old. So you can always cross-reference. But because you do have time, the exam is only in February and there's ample and lot of time. So obviously we can do that if that works for you.
Thanks, Sonia.
Thank you.
Yeah.
Any other questions from anyone else, guys? Anyone else can raise your hands? No? Okay, if there's no other questions, probably means yes,
just
Mazi.
a question. Sorry. You mentioned you used UpToDate and CatPearl. I misheard you.
It's StatPearls.
Sorry?
It's StatPearls.
Okay.
Yeah.
Got it. Thank you.
Yeah. Mazin?
First of all, congratulations to all those who passed, and thank you very much for sharing your tips and experience. That's really helpful for us. I have a quick question. There is a book, Companion Cases, by Alexander Phillips and Bhaskar Kumar, and there is like a new updated version. Has anyone had a look or used it?
Yes,
I did use
I
it
have.
too.
I have used it.
And what do you think?
So the information, so you don't need both books. You can go through it once, but you just stick to one book. I think that will be more than enough, because the information that both books are overlapping, so it will be extra effort with minimal gain. That's what I felt.
Sure.
But is that updated now? Is it a new edition which has come
There's
out?
a new edition. Yeah, I think it just came about.
Means I think
It's not updated for breast though. It's still
okay.
old.
Means if it is a new edition which has come out, because I have never touched that book, because the book, both the books came in the same year. But if it is a new edition, probably it's worth going through that book, I would say, more than the other one. That's my advice. But yeah, because the book, the Cracking the Viva, has not been updated for quite some time. And there is another book which is going to come in the next 1 or 2 months, actually, by the Phoenix Course group, actually. So which is the chapters were written by different high-end consultants in majority of the specialty. Means me and one of my colleague had written chapters on transplant, actually. So that's going to come out as well with a very updated one. I don't know when is it going to come, but hopefully in a month or so. But as we all discussed, you just need to stick to one book which will give the basic knowledge of your syllabus, which is exactly replicating what Sharanya told of whatever is given in the website on what is the topics which you need to be aware of. Yeah.
Thank you.
Yeah. Good. So Mina is there. Mina is our breast faculty. I think probably he wants to give a talk.
Can you hear me?
Yes, Mina.
So,
Welcome back.
Ahmed, hi. 3 things about the book when you ask about it. The first one is life is too short to read 2 books. If you read once, read it again before the exam. Don't go halfway and go to another one. You will forget what you have read in these 2 books. Second, the most important things are the guidelines for your specialty. They are more important than any book. 3, no companion. They're very bad.
I agree.
Pick
Thank you.
any book, but not the companion.
Yes.
The problem with the companion that it's not efficient. The problem that the information are outdated and wrong.
Okay.
Exactly.
Thanks.
Agree.
Thank you. Thanks for the
Yeah,
advice.
yeah,
Thanks,
yeah,
Mina. Thank you.
Yeah. Ahmed Riyad?
Yeah, hi. So I passed the part in June, yeah, and since then I haven't opened any resource or anything. So is this period from now on to till February will be enough?
Yeah, absolutely. Yes,
More than enough.
more than enough. Exactly. You have like 3-4
More than
months.
enough.
In fact, the gap between the September exam and the February exam is very wide, actually, because you have Christmas holidays coming in between and stuff. So you have a lot of time, actually.
Right. Thank you.
Yeah. So my yes, sir, Ahmed. Yes.
Sorry, try and print out. There is, I think, if you can, the syllabus. That I think you'll get a short form of the whole syllabus of the GCIE kind of. I think there's one somewhere. I found it. So try. That is how you start. You don't necessarily have to start reading now. You've got good time, but you're gonna look into the syllabus and you're gonna tick all the syllabus. So at least you have an idea. You're not gonna go beyond the syllabus. So that sit down, look at the resources you have. You know where to go when you need something, and it takes you about a month or 6 weeks to get in the right mindset before you actually start reading. So you've got a really good time.
Thank you.
Yeah. So what I would advise is I've just written a blog yesterday, which we have released on behalf of our course, like how you want to prepare yourself. So first of all, as Ahmed told, everyone are different. Yeah. Whatever Muhammad told or whatever Sharanya told may not be fitting into you. You might wonder how they prepared like this. Okay. So everyone are different in terms of, there are strengths and weakness for everyone. There are a few candidates who can speak out, even if they don't know anything, they can speak like a scholar. But there are few people, they know everything, but they cannot open their mouth at all. Yeah. Sure. So again, there are few candidates who, whatever we say, they cannot present themselves as a consultant because they never handled that level of discussion. And there are few, even if they don't know, they can speak more than a consultant. Okay, so this exam is what, like everyone told, is a balance between your knowledge, your mannerisms, your attitude. That it's basically, I would say that it is an exam which is like a consultant interview exam for appointing you as a consultant. So you need to think in like that way as a consultant interview, and you need to crack on to get your job as a consultant. This is what is expected in the exam. So I know that you have plenty of time, but I think you should all start warming up. Okay, you should have plans. Start with when you want to plan, when you want to start studying, how do you want to plan your weekends. Yeah, so we have given our schedule, so go through it. So it is definitely difficult for you to be available on all the weekends, but still try your maximum level best. And as Mohammed told, trying your best to clear in the first attempt is always the best. Once you clear, once you fail, means the common question our own course candidates who didn't were not successful, they ask me is what differently they could do. Means I really didn't have an answer to tell what differently they could do to succeed in the coming exam, because you just need to go do the same. I really didn't have any answer to tell, okay, so you are weak in this, do this, or you didn't prepare well, do this. So they did everything, okay, to the maximum, but still they weren't successful. So if they ask me, I don't know what more they could do, but from your point of view, do your best, give your maximum. And if you're successful, it's okay. If you're not successful, it is fine. But at least even if you're not successful, you should console yourself telling that you did your best. Okay, that's one thing which I want to tell. And carefully plan your resources well. As I told, there are plenty of resources, and once you start in our course, if there are open discussions, you can openly ask us where to study what, and we are much happier to help on that in that regard. One thing again, what they told is, unlike I don't know how many of you here have registered in our course, but because it's a 3-month program and it's every day almost some activity will be happening, some discussion will be happening, weekend there will be something, weekdays there will be a lecture. More the commitment and more the attendance you give on most of these sessions, definitely higher the chance you will pass, which we have been constantly viewing. So almost everyone here, whoever came today, I think almost they attended most of the sessions, or at least, even if not, at least they went back and gone through whatever session has happened in the recordings which has been put up. Yeah, that commitment and serious thing should be there, or else it's not going to be an easy task at all. This is what I would say. Yeah. Senthil Rajan, you want to ask anything? Senthil? You can unmute yourself. You have raised your hand. Okay, he's not there. Mohammed El-Nahi, you're here. He's our colorectal faculty. You want to give any piece of information, Mohammed? Are you there, Mohammed? Yes.
Yes. Yes, I'm here.
Yes.
Hello, guys. So, congratulations to all who have passed the exam, and very warm welcome for the people joining the course. And hopefully you follow the footsteps of your colleagues and pass the exam as well. So I just got a few points for you to understand, that I hope you try to comprehend them well. So first of all is, you need to understand what you are up to and how to prepare for this exam. So if you are going to run a marathon, there is no benefit of practicing swimming. So you need to train how to run a marathon. So you need to understand exactly what is this exam like and what is expected from you in the exam, so that you'll be able to practice what you need to deliver. Okay, and this is very, very important. The other thing as well is in terms of the sources, I think this has been discussed in details. It's just the most important thing would be the up-to-date guidelines from all the societies from different specialties. The other thing as well is commitment with the course, and the course schedule is very important. And the course gives you a schedule that you can follow with your studies as well. So if you study each specialty, by the way it is scheduled in the course, this will be very, very helpful. And you will gain much more benefit from doing that, and give you as well a framework to build your studies on. So try to stick to the schedule as much as possible, and try to revise the subject before coming to the Viva as much as possible. And what is very good about this course is the course is spread out over 3 months. So from the first day you join the first Viva, you would have immediate feedback about how you perform. And this is very, very important, because there is no other course that is going to give you that. Most of the courses are just done 2 or 3 weeks ahead of the exam, so you don't have much time to reflect on how you performed, and you don't have much time to improve your performance or improve your delivery on the answers. And this is why it's very important when you start the course, go back and see what you have done and how you performed, how you delivered your answer. This is very important because this is what you need to improve on. So the exam is the most important part of the exam is how you perform in the exam and how you deliver your answer. And what I've noticed is most of the candidates who are doing the exam are international medical graduates, and their English is not their first language. And it's very difficult sometimes when you are in a stressful situation with all the nerves around the exam to be able to think clearly in English, which is not your first language, and formulate an answer which is precise and concise and suitable for the exam. And this is why you need a lot of practice. So if you know that your English is not good, you need to spend lots of efforts in trying to improve your English, and you try to shine it as much as you can. This is very important. And the only way that you can do that is by practice. To try to practice as much as you can. So, and practicing the Viva is very, very crucial for the exam. So this is how you prepare. So just this is the practice that you need to do to be able to deliver your answer in a proper way in the exam. So you need to practice as much as you can, especially if your English is not your mother tongue. So it's very, very important. And we'll try throughout the course, as the length of the course, to give you an honest feedback and give you comments on how you improve yourself, and if you delivered this answer in a good way, and how to talk, the base of your talking, the base of delivering the answer. Because as the previous candidate mentioned, so the hall is very big and the exam is very noisy, and if you are not if you deliver his answer in a very quiet manner, and what you are saying is not clear, the examiners will be missing half of your answers. And this is why people will be surprised. I think I performed very well, but I haven't got the marks that I deserve. And the problem is the way you delivered your answer, or the base of how you've been talking, and maybe the examiner missed half of your answer. And then this is why they haven't given you the marks that you deserve. So this is very, very important. This is what you need to practice. You need to practice how to deliver your answer in a good way, in a good base, in plain, clear English, so the examiners can pick all the answers that you are delivering. Okay? And all the best for you all, and then we'll see you in the course.
Thank you so much, Mohammed. Thank you. Senthil, are you there now?
Yeah. Hi.
Yes.
Sorry, I think I just had some connection problems. So
yeah.
I'm actually, it might be a silly question, but I'm giving my part A actually in November, and I'm planning to give my part B sometime next year. So will the course be useful for me now, or should I, just join for it later?
Let's see. Part A means I would not if you are if you're very confident that you are going to clear part A in November and you are going to take your exams in February, if you are planned like that, then there's a point in taking the course. But my question is, even if you clear your exams in November, will you be taking your exams in February is my question.
Yeah, that would be the plan, but yeah, like you said,
if you are planning to take in February, okay, even if you say 30% chance, that means if you pass, you are going to take the exams in February, then definitely it's worth joining actually.
Okay, thanks.
Yeah, thanks. Wheel Ramadan, sorry, yeah.
I think a very interesting question. Sorry.
Yes, Ahmed. So someone who's answering here.
Sorry, it's me, Ahmed. Sorry. Yeah,
yes.
I can speak after. No problem.
No, it's fine. Carry on.
So that question was very interesting. I'm the type who in part 1, I was also subscribed to FRCS Viva before I knew about your course, to be fair. So again, is understanding how you learn and all that, and that will help you, and your plans basically. So you've given him a good answer, to be fair.
Means if you ask me, means we do recommend even Section 1 candidates to join our courses. Means we have plenty of candidates who have joined as observers, because this gives you a very wide knowledge of understanding of the concepts, definitely. Because I think Section 1 exam is much difficult than the Section 2 exams, which I think everyone will know that, because whatever resources, wherever you study, no question is going to come the same in your exam. So the only aim of preparation for Section 1 is to solidly build your fundamental knowledge. And I think joining such a vast course with discussing all these specialities, what is your next step in the management, what is this one, this is what is the question which is going to come in the part 1. So I would still suggest anyone who's taking Section 1 also to join any of the Section 2 course to build your knowledge, actually. That's what I would say.
Absolutely. Yeah.
Perfect. Thanks, guys.
Yeah. Veer Ramadan. Sorry if I'm not calling you properly.
No, that's fine. First of all, congratulations for the people who passed. I'm just having a quick question. So from the candidate who passed, how many was trainee and how many was non-trainee? And do you feel that there is a difference in the exam result between, like, if there is any variation between being a trainee or not, in how they score the people?
So it has been, it's a common thing, you know. So in our course, you know, majority of them are non-trainees. Okay, so in last course we had around 29. Let me mute you. Yeah, sorry. In the last course we had like 29 registrations, of which we had only maybe 5 or 6 trainees. The rest were all non-trainees. Okay. So I don't know, because most of our faculty members are non-trainees here. Maybe this is attracting this crowd, I don't know, but this is how our distribution is. But if you go into the actual results per se, in general, the average pass percentage for Section 2 exams is somewhere around 60 to 70%. I mean, when I say pass percentage, it is leave the first attempt or second attempt. So any exam, anyone who attempts, the normal pass percentage is 60 to 70%. I don't know what is the pass percentage for this particular exam, but this is the average. In that, if you see the trainees, usually it is 70 to 80% pass, while the non-trainees, the pass percentage is somewhere around 50 to 60. This is what was the statistics almost a year back. Mina, you want to add anything if I'm wrong on this?
No, you're not wrong. If you don't mind me commenting on the same question for Wa'il.
Yes.
So we know historically FRCS has always been in favor of the trainees. So we know that trainees pass rate is higher than non-trainees. And that's not an unfair thing. That's not a bias. It's an exam made and designed to assess the outcome of a proper UK training. I always give an example with the breast. If you are someone who came from Egypt or from India and you have been working at DGH, which is the classical scenario for someone who's sitting for this FRCS, you spend 5 or 6 years mostly doing colorectal, and that's why most of the international graduates, they go for colorectal, okay? And you got your references, you're sitting for the FRCS exam. Most commonly, you have never done a breast job in the UK. However, you are assessed against ST4. But a proper UK trainee has spent 6 months doing just a breast job. That's why you might find the UK trainees, they just spend 2-3 weeks preparation and just going through. If you're an international graduate, you need to go the extra mile. You have to understand that you are someone who's hacking the training system to get the same outcome. So you have to spend extra effort. So yes, the pass rate for trainees is higher than non-trainees, but that's not because they are biased against non-trainees. It's just how the format of the exam is.
Exactly.
GCIE website, and I think it's the same with the other website, do have a breakdown of non-CCT or CCT percentage of passing in every up till May. You can find even the results and percentage of passing rate.
Yeah. Good. Any other questions, guys? Yeah. If not, Mohammed, do you want to add anything, Mahmoud? You have raised your hands.
Sorry, that was thumbs up for the comment.
Okay, fine.
To summarize, it's you on the exam. There is nothing against you during the exam. You go in the exam, you get asked the questions, you answer the questions. Don't think about the percentage. Don't think about the statistics. It is you and the exam. Go for it.
Yeah. Good.
If I can just add final thing, Manny,
Yes,
for
Mina.
those who passed, I would say you really should be proud.
Exactly.
Probably from the faculty, I'm the one who has finished my FRCS probably the first, 2019. I think I'm one of the first one. And since then, even before joining this course, I've been helping people to clear the FRCS. This is the hardest exam in the last 4 years.
Yeah.
Okay, this is the worst result
Exactly.
that I have seen in the last 5 years, I would say. Okay, so yes, if you barely passed, you should be really proud of yourself. That's a great achievement.
Exactly.
I know few who did not pass, but I think they deserve to pass. That's one thing. For the next cohort, I would say, remember, it's not all about knowledge. It's all about how to present yourself. That's 50 or 60% of the exam. Actually, it's not mainly about the knowledge. Make the best use of that course. There are two things that this course offers compared to others. A is that you get loads of vivas every week. So you practice. When someone vivas you, it's not like the same when you're sitting in your room behind a closed door, asking yourself the question and answering to yourself and assessing yourself and admiring how brilliant you are. No, it doesn't work like that. It always helps when someone else assesses you. The grass is greener from the outside. You might think that you know the answers, but actually it's not the case when someone else vivas you. The other thing that you should benefit from, you've got a mentor faculty here with you every day for 3 or 4 months. Okay, if you're not going to make use of these two advantages, I would say you go for another course. Just spend 2 or 3 days rather than wasting every single weekend for the next 3 months. Thanks.
Yeah. Thank you so much, Mina. Thank you. So thank you everyone for your time on a Saturday night. And once again, big congratulations to the pass outs. And hopefully I'll be speaking to you very soon, requesting you to join our team. Okay. And you can come back to the other side. And I would also request you to tell your friends and colleagues about the course. The next course we have advertised, and almost like good number of candidates have registered, but it's still a month to start. Actually, we're starting in October 22nd. Actually, it's more than a month from now, but do spread the words. And even to others, whoever has come here, whether you have registered or not, please feel free to go through our brochure and stuff. And if you have any queries, you can directly contact us or people who have already done. And if you're interested, register for the course. Yeah, thank you very much once again.
Before I sign out, Mani, thank you and the team a lot.
Thank you very much.
Okay, so
Absolutely.
for all the confidence you instilled in us, all the effort you have put in, to be honest, I won't be able to do this without support from you guys. That's my feeling. So much. I think others will agree with that as well.
Absolutely. Thank you.
Thank you so much for these words, guys. Thank you.
Yeah.
Thank you.
Okay. No worries, Mani. See you again.
Yes.
Bye.
See you guys.
Thank you, Mina, as well. Thank you
very much, guys. So nice meeting you all. Bye-bye.
Bye.
Thank you. Congratulations for everyone.
Bye.
Thank you very much.
Thanks.